There has been an increase in measles cases reported in your district. If health workers do not document and report these suspected cases, children may not be treated properly and the disease could spread. And if suspected cases of vaccine-preventable diseases are not investigated, the program may not be able to confirm an outbreak and will not know how to respond. As a district surveillance supervisor or district medical officer, it is your responsibility to make sure health workers know when to document, report, and investigate suspected cases of vaccine-preventable disease. When should a disease be documented? In fact, all suspected cases of vaccine-preventable diseases should be documented. This means that health workers must first be able to correctly identify the suspected disease by referring to its standard case definition. A standard case definition is an agreed-upon set of criteria, usually clinical, used to decide if a person is suspected of having a particular disease. WHO has recommended standard case definitions for selected vaccine-preventable diseases. Use of standard case definitions ensures that a suspected case is identified in the same way in the whole country, regardless of where or when it occurred or who identified it. As a district surveillance supervisor or district medical officer, you will need to introduce standard case definitions to all health facility staff to ensure that every suspected case can be accurately identified and other conditions can be excluded. Keep in mind that if a case meets the standard case definition at the health facility level, it is first labeled as a suspected case. Once a case is investigated, it is labeled confirmed if it meets certain conditions, depending on the disease. Confirmation may require positive lab results, a link to another confirmed case, or certification by a district surveillance officer or district medical officer based on clinical data. When staff have identified a suspected case, it should be documented in a tally sheet and a line list. Some diseases may need immediate investigation, which requires a disease-specific case investigation form. Next, when should staff report a case? In general, health workers should report all suspected cases of a vaccine-preventable disease. It is better to over-report suspected cases rather than potentially miss a case. Suspected cases can always be confirmed or discarded after further investigation. How frequently cases should be reported depends on the disease and national guidelines. While all cases should be included in monthly reports, some may need to be reported weekly or even immediately. For example, if the disease is under eradication or elimination, report the suspected case immediately. Finally, when should a reported case be investigated? The type of cases that should be investigated depends on the disease and the surveillance objectives of the disease control program in your country. As a general rule, however, if the disease is under eradication or elimination, every suspected case should be followed up and investigated. If the disease is to be controlled, it may be sufficient to investigate the index cases or first cases of a cluster to confirm the diagnosis. If confirmed, then do an active search to determine the extent of the cluster or outbreak. And if there is a confirmed outbreak, you may not need to investigate all suspected cases. This will depend on surveillance guidance established at the national level. To investigate cases, staff should use disease-specific case investigation forms. This investigation is usually collected face-to-face and can involve visits to homes, hospitals, or communities to collect data. Ensure that reliable data is recorded since it will be used to decide whether public health action is necessary. Remember, it is important to make sure that health facility staff knows when to document cases that meet the standard case definition, report suspected cases, and investigate suspected cases according to your country's disease control program.